have a history of bipolar disorder. I knew I should have talked to my doctor when I was experiencing manic episodes. My doctor told me about a drug called Depakote. Depakote is an anticonvulsant which is used in the treatment of bipolar disorder, seizures, and migraines. Hi, Dr. Billy.
Hello, Milfred. How are you today?
I'm alright.
Good, good. What brings you in?
I was wondering about that drug you prescribed for me for my bipolar, that
Depakote?
Yeah.
Okay, yeah. What are your concerns about the drug?
I don't know when to take it or anything about it.
Have you started the medication yet?
No, not yet.
Okay, well, I'm going to have you start taking it at nighttime just because of the sedative effects such as drowsiness, dizziness. Also, I'm going to have you take it with food to decrease the stomach irritation. Also, do not take it with milk or carbonated beverages such as soda, things like that.
Can I take it with my prune juice?
Yes, you can take it with prune juice. That would be fine. Okay. We're going to have you take the whole tablets. There is different kinds. There's kinds that you can break up and sprinkle on food and stuff. But I'm going to have you on the whole tablet, so you make sure you swallow those whole.
Okay.
Also, when you're first starting off, I want you to avoid activities such as driving and running, different things with increased exercise. And this is because of the effects that the drug may have on your body, and you want to know what the drug, how it makes you feel.
Okay.
Also, this drug could cause some hair loss, weight change, nausea, vomiting, and some abdominal pain. Can be common just side effects of the drug. Okay. Do not stop the drug abruptly, and also if you decide you have a cold, different things like that. So over-the-counter drugs, herbal supplements, please notify me when you do take those, because those can conflict with the drug Depakote. And since you are going to be on this drug, I'm going to have some monitoring going on, just of some different labs, such as your liver, platelets, plasma ammonia levels, different things like that, just to make sure everything's in check and the drug isn't having a negative effect on your body.
Okay.
Also, I do have actually a pamphlet here, and it just goes over things that we talked about today, things that you should not take it with, some things to expect, different things like that. You can take that with you. Okay. And if you have any other questions concerning Depakote, you can go ahead and give me a call. And if you have anything else for me today.
I think that's it. Thank you.
Okay, thank you. You have a good day.
You too.
All right. Depakote works by increasing the GABA levels in your brain. Absorption has a peak of 1 to 4 hours, an onset of 2 to 4 days, and a half-life of 9 to 16 hours. When distributed, Depakote has a protein binding of 80 to 90% and is decreased with renal and hepatic impairments. Depakote is excreted through the kidneys and can also be dialysized.
Do not take this drug if you have hepatic failure, pancreatitis, are or may become pregnant, a history of recurring vomiting, ataxia, suicidal thoughts, thrombocytopenia, or a family history of urea cycle disorders. Common side effects usually associated with Depakote are abdominal pain, diarrhea, loss of appetite, nausea and vomiting, dizziness, nervousness, insomnia, somnolence, sedation, blurred visions, palpitations, tachycardia, suicidal thoughts, pancreatitis, hepatic toxicity, hypothermia, thrombocytopenia, liver failure, immune hypersensitivity reaction, autotoxicity, and weight gain. Do not take with any CNS depressants including alcohol, antihistamines, antidepressants, opioid analgesics, MAOIs, or sedatives. Depakote has helped me significantly in controlling my bipolar disorder. I'm glad I talked to my doctor, and so should you. Remember to tell your doctor if you have any suicidal thoughts.
Depakote has a black box warning of hepatotoxicity. This usually occurs in the first 6 months. Also, discontinue the use of this medication if you become diagnosed with pancreatitis. Notify your healthcare provider if anorexia, abdominal pain, severe nausea and vomiting, yellow skin or eyes, fever, malaise, facial swelling, unusual bleeding or bruising, pregnancy, or loss of seizure control occurs. This production has been brought to you by Dildoc Studios, with a special thanks to Davis Drug Guide, Micromedics, and Medscape.
Okay, I'm ready.
Hi, Dr.
Hi, Wilfred. Your glasses. Hello.
Hi, Dr. Dilly.
Hey, Milfred. How are you today?
I'm alright.
Good, good. What brings you in?
I don't know. I was just wondering some questions about that
I was good to go. Hello, Milford. Oh, hello. Hello, Milfred. How are you?
Bailey, I'm alright.
Good, good. What brings you in today?
I was wondering about that medicine you prescribed me for that bipolar, that Depakote.
Yeah, Depakote. Okay.
Yeah.
What were your concerns?
I don't know when to take it.
Okay, and you haven't started the medication, correct?
No.
Okay. When you do take it, we're gonna start you out at night.
Why do we suck at this? Hi, Dr. Daly. Why are you laughing already?
Depakote works by increasing the GABA level in your brains. Absorption. I just said brains.
Hi. Tell me when.
No.
Hello. I have a history of type 1 bipolar disorder. I knew I should have talked to my...
7.
Hi. I have a history of manic bipolar disorder. Bipolar type 1 disorder. I knew I should have contacted my doctor when I started experiencing...
Stop rocking!
I knew I should have contacted my doctor when I started experiencing severe
Severe manic
episodes.